This is Zheng Yulin in Shanghai, China. I'm going to talk about our chapter, Neurosurgical Treatment for Anorexia Nervosa. Anorexia nervosa is a refractory psychiatric disorder with high rates of morbidity and mortality. It is characterized by a restriction of energy intake, leading to a significant low body weight. Patients have an intense fear of gaining weight or becoming fat, and have a distorted self-perception of body image and weight. The etiology of AN remains unclear. It involves complicated interactions between genetic and epigenetic, biological, cognitive, and social psychological mechanisms. The conventional psychotherapies and pharmacotherapies have limited efficacy in adult patients with AN. Currently, especially for severe and persistent cases of AN, two neurosurgical options could be discussed: deep brain stimulation and stereotactic ablations. For DBS, the nucleus accumbens and subcallosal cingulate are two targets mostly studied for AN. For ablation procedures, capsulotomy and cingulotomy could be proposed. It should be mentioned that both these two options remain investigational, and that the choice of DBS versus ablation depends on the type and the severity of the disease, as well as the patient's belief in current physical condition. Here is our proposed grading system guiding the surgical treatments for AN. In our clinical practice, we grade AN into 4 levels. The grade 1 indicates that patients have no experience of psychological therapies associated with no or mild functional impairment. We propose conventional therapies rather than neurosurgical interventions in this patient group. From grade 2 to 4, we believe that neurosurgical treatments can be discussed because patients suffer from recurrence after several hospitalizations with considerable functional impairment. For grade 2, the patients report no suicide ideation or attempt. We propose an ACC-DBS. And for grade 3 and grade 4, the psychiatric comorbidities as well as suicide ideations and attempts are debilitating. The anterior capsulotomy can be proposed. A total of 9 studies have reported efficacy of DBS in anorexia nervosa. The first case report was published in 2010, targeting subgenual cingulate cortex. Our team firstly reported the retrospective results on the efficacy of nucleus accumbens DBS in 4 patients with AN in 2013. In the same year, Lipsman team reported their promising results of phase 1 pilot trial of subcallosal cingulate DBS with 6 anorectic patients, and the subsequent 1-year open-label trial in a larger cohort containing 16 patients was published in 2017. Most recently, in 2020, our team reported the largest prospective DBS cohort targeting nucleus accumbens during 2-year follow-ups. Totally 28 patients completed the protocol and were included in final analysis. We can see that both NACC-DBS and SCC-DBS can contribute to the weight restoration as well as symptom relief of mood comorbidities in treatment-resistant anorexia nervosa. Furthermore, the ventral capsule, ventral striatum, and the medial forebrain bundle were all reported as potential DBS target for AN, but only case report was published. Taking the NACC-DBS as an example, this image shows a representative electrode placement into the nucleus accumbens by our team, indicated by the red arrow, both in axial and coronal view in MRI. Compared to preoperative baseline, significant increases in BMI and psychiatric scale scores, OCD, anxiety, and depression were noted during the 6-month follow-up and were maintained at the 2-year review. Furthermore, impairment on social functioning was also significantly improved after the surgery. No obvious decline of cognition was detected by mini-mental state examination. There are fewer studies on the ablation procedures for the treatment of AN. The first case report was published in 2011 regarding one OCD patient comorbid with AN undergoing bilateral anterior capsulotomy. Nucleus accumbens ablation has also been used to treat AN, but has been abandoned because of severe side effects. Recently, in 2018, our team reported promising results of 3-year follow-up of capsulotomy in 74 patients with treatment of refractory AN. Significant weight restoration and symptom relief of mood comorbidities were observed during the follow-up. Here is an example of the anterior capsulotomy by our team. Red arrow indicates the location and the extent of the capsulotomy, both in axial and coronal view in MRI. Also taking our work on capsulotomy as an example. Compared to preoperative baseline, significant increases in BMI and psychiatric skill scores were noted during the 1-year and 3-year follow-up. Impairment on social functioning was also significantly improved after the surgery, as evaluated by SDSS, Social Disability Screening Schedule. No obvious decline of cognition was detected by MMSE, Mini Mental State Examination. In conclusion, anorexia nervosa is a complex, life-threatening psychiatric disorder with high relapse rate with conventional therapies. The exact etiology and neurocircuits responsible for AN should be further elucidated. Neurosurgical treatments for AN always remain investigational at this stage. First of all, patient selection criteria should be further clarified. In addition, the safety and efficacy of DBS and stereotactic ablations should be further investigated in larger prospective cohorts. Besides, studies on some specific aspects, such as neurocognitive change after surgery in AN, are also expected. And lastly, other potential DBS targets, such as STN and zona incerta, merit further investigation, firstly in corresponding animal models. Thank you very much for your attention.